Bound TV, RRT Posse YouTube. If you're new to the channel, please like, subscribe, and turn on post notifications. I release scheduled videos every Monday, 12 o'clock a.m. Eastern Time. But I also release some unscheduled videos throughout the week. Now, if you're returning, hey, welcome back. I appreciate all of the support. Thank you. What we represent, man?
Big money bound.
Say, let her know, man.
Big money bound.
Last night was my 6th day in a row, man. I just finished 6 out of 6. I'm finally free. I finally got a day off, man. They did not give me that day off easily, bro. Last night, oh, man. They got me, bro. It was busy last night, man. And the night shift, it started off. Nurse had suction the patient. All right, cool, teamwork, man. Suction is like a shared responsibility. Like a nurse can suction, therapist can suction, charge nurse can suction. Everybody know how to suction the patient. Okay, cool. So I come into the room. I seen that the nurse had suction the patient. So I say, hey, how much secretion did you get back? Oh, I got back a little bit. I got back a little blood stuff is still left in the tube. And can you clear the line for me? So hold on, time out now. Hold on now. You just suctioned the patient. And there's mucus left in the tubing. And you want me to take it out when you just suctioned? Hey, bro, come on now. Hey, bro, hey, you gotta, clean up after yourself, you feel me? That's what I'm saying. So I'm like, all you gotta do is just, flush the line out, bro. Put it in there. I'm thinking the nurse don't know how to do it. Oh, yeah, here you go. Dog, hand me a syringe. Here you go. To go do it. Hey. As he handed it to me, instead of putting my hand out, I point you just go hook it right over there. You go ahead and you suction, man. So, okay, I'll do it. Yeah, you gonna come on, bro. That's like me drawing the ABG, taking a needle out, and telling the nurse, hey, come put a Band-Aid on this right here. Come put a Band-Aid on it. Bro, what are you talking about? Bro, finish doing your job. You have to do something halfway. You suction, it's something left in the tube, and you clear it out. So, hey, dog. That's how I started out, man. On another note, speaking of suctioning, a nurse came up to me. I was like, yeah, it's this patient back here in this room that's on a trach and that needs suction. I'm like, yeah, I already checked on that patient. I suctioned them. Everything is good now. They like, all right. Could you show me what you did? Because I'm not comfortable with suction, and suction is something I don't like doing. Can you please show me how to do it? RNs and RTs working together. If you asking me just straight up, man, a professional from nursing point of view, I don't really know how to do it. I'm uncomfortable. I love to show you, bro. I don't mind doing that. If I got time, bro, of course I can show that, no problem. So I go in there with the nurse. So I'm showing her how to do it. I'm like, yeah, so because they got the Omniflex. It's a device called an Omniflex that hangs from the trach. It's like an accordion. And you gotta push it together to get the ballot through there. If you don't push it in, it'll just get stuck within there. So you gotta pull it in. So I'm showing how you pull it in, then you supposed to go in. She thinking I'm finna do it. I'm like, all right, now you try. She's like, oh, but can I just call Respiratory? Can you just do it for me? I'm just so uncomfortable. Hey, bro, hey. Now, you can't call. I'm going to be busy, dog. You can't keep calling me. You got to figure out how to do it. All right, so I hold this. Yeah, you hold that. You go in there. And I'm like, I understand. Suctioning is something that's unnatural. This isn't normal. You're supposed to be able to cough and expel the mucus. So when somebody got to go down your throat to take the mucus out, it's going to feel uncomfortable. And you're going to let it be known that, yeah, this is uncomfortable. And honestly, the person that's doing it gonna feel somewhat uncomfortable because as you take that ballot down and it goes down the throat, the patient's gonna be but that's when you start. That lets you know that you're in the right spot. But you're gonna feel I don't want to hurt nobody, but you're trying to help them. So I understand how you gonna feel, how you feel. But I've been doing it for so long that I know what come with it. So I'm like, all right, when you get where you need to be, the patient gonna tell you where you at. So once you hear the patient start coughing and making noises, you stop. Cool. She get there, she pull it back. She pull it straight. I'm like, hey, you pulling that back a little too fast, man. So just next time you do it, just go in there, nice and easy. just nice. Just come back slowly, nice and easy. We trying to get mucus. We ain't at NASCAR. We ain't. Hey, this ain't no lawnmower. You feel me? You don't just. This ain't no. Y'all get what I'm saying. But I ain't trying to be funny. But I ain't. It just. That's how it is, man. So I showed Shorty that everything was cool. So I go to a cardiac arrest, code blue, dog. I mean, bro, it's like 12 people in one room, only one therapist in there though. My homeboy was by himself, so I got in there, I helped him out, helping the doc grab tubes, this and that. We intubate the patient, you feel me? But they don't know if the tube in the right spot. They trying to figure it out. They're not really too sure if it's in the right spot or not. Inside of CO2, I guess after you like bag so many times, it don't really like turn colors anymore. So they was unsure. So you're supposed to look at it from the beginning. But I went up there. I was passing back supplies. You know, I was just, here you go. That's, you feel me? So that wasn't me now. So they trying to see if it's in the right spot. At the same time, they trying to check the patient's heart rate. So okay, I'm gonna shock this rhythm. You know, when you shock, you gotta clear, bro. That tube not secure now. I'm like, hey, that tube ain't secure. I'm like, the tube ain't fly out. They said clear. They shocked that patient. The dog said, once he felt that volt electricity, that ET tube, pew! It ain't funny though. It ain't. I'm just telling y'all what happened. It ain't funny though. ET tube came up. Had to re-intubate. Like, dog, I told y'all, man, secure that tube. Nah. You can't shock unless that. But then again, like, if this the rhythm, I gotta shock the patient. I got to. Hey, dog, each his own, man. That tube came flying out like a bat out of hell, dog. Pew! Pew! I'm just in such a good mood because, like, I'm off, you feel me? This is my day off. I've been going ham, bro. Like, I've been going ham with the videos. I've been going ham with work, man. I'm just, like, overall, like, I'm in that tunnel vision, you feel me? Like, I'm in that zone. And like I was saying before, like, I can be so focused and, like, so tunnel vision on what I'm doing that I don't realize what I'm doing. Like, until somebody stops me in comments and says something like, hey, man, thank you for all your videos. Like, you're the reason I chose respiratory therapy. Your videos helped me get through the program. And then I'm like, damn, I am making good videos, ain't it? But as I'm doing it, like, you don't realize it. It's like, I used to play basketball. I was a hooper. When you in your zone and you just dropping buckets after buckets, like, you don't know how many points you got. You just know I'm getting buckets. You finish the game, I had 45 points. Damn, I dropped 45. I used to drop 45, dog. Cause when I was out there, man. If you seen that video, if you know if I wasn't an RRT in the NBA, that's where I would be. You feel me? But anyway, man. RTs gotta help RTs, dog. I go in the patient room, I give a patient a treatment, man. Patient tell me, how many liters do you put my treatment on? I'm like, okay. Never get no precise answer when it comes to something like that. Never give a precise time. I'll be back at 6:30. They're gonna be on their clock till 6:30. I put it at 6. Okay, you say 6. This person say 8. Hey, I put it between 6 and 8.5, maybe 9. Wow, what's going on? Oh, because the therapist before you said they put it on 5. See what I'm saying? And they said they put it on 5 because if it's put on like anything above 5, it'll be nebulizing too fast for me to get my treatment. Bro, who would have told this person that, man? I'm giving this person Pulmicort, which is a corticosteroid, which can't be given without a bronchodilator, so I'm giving Duoneb on top of that. I'm giving 2 meds on 5 liters? Bro, that'll be 45 minutes, dog. That'll be about 45 minutes, man. And I gotta go see 28 patients on a 12-hour shift? Y'all let me know in your book. From what I heard, the book I read, it was from 6 to 8 in the book that I read, but it may be a little different now. So I put it between 6 and 8. But when she's saying this, when the patient is saying this, I'm like, I gotta rebuttal. I'm like, well, you know, Of course, if you turn the flow up too high, the treatment's going to be going out fast and someone's going to be getting lost. That is true. But if I was to put this at 5 liters, actually, it wouldn't be nebulizing properly. You have to be at least between 6 and 8. If I put this on 5, it would take so long for you to finish this treatment. I don't know if you'll get it all, man. I don't know. So the lady's like, okay, I understand what you're saying. As long as I'm getting my treatment, all right, cool, man. That's why, like, you never leave the next therapist hanging, man. Like, you don't, that just ain't something that you, even if something is done incorrectly, you don't let the patient know it's done incorrectly. You just say, oh, okay, that's how they did it. I prefer to do it this way. I prefer. Either way is correct. You don't just, bro. I put mine at 5. Let me know in the comments, please, bro. Have you ever put a breathing treatment at 5? I've never seen that done. I never did. I never heard of that being done, bro. 2 treatments at one time on a rate of 5, on a 5 liters? Come on, man. I don't know what dog get that from. So I'm like, but I don't want to say she wrong. I'm like, I don't want to say the therapist before me was wrong. I don't know if he was wrong. But over the years, with medicine, we become like more advanced. We understand more. So the nebulizer that therapist is used to using probably couldn't go above 5. But now with these new modern technology now, you can go from 6 to 8. Because these different nails, you feel me? So that just had me like, bro, you don't leave no therapist hanging like that just saying, bro, you don't. I never do that. I never come around somebody saying that, oh, they did this wrong, it's not supposed to be done. Never. Even if it's something that's done crazy, I won't throw another fellow respiratory therapist under the bus. Now, I go talk to him when I see him, like, hey, bro, hey, you made a mistake with that, dog. But I won't tell him, I'll never do that. That's just me, bro. That's just me, man. What else I got for you, dog? Okay, last thing. This last thing, man. Critical thinking plays a major part in respiratory therapy, man. You know, it's all good. You check your vents. Ain't nothing going wrong. It's all good. Checking your vents, doing this here suction, and checking inspiratory pressure, peak pressures. All that's good. Giving treatments, end-line treatments, ABGs. That's cool. You having a good night. When something go wrong, though, you got to be on your toes. You got to know what you're doing. You have to know. They call me. Patient on a ventilator, not ventilating, need to be bagged. Come quick. Hold on. I'm coming quick, but while I'm coming, I'm thinking, I'm not finna sit here and just ambu bag a patient all day. So we got to figure out what's going on, adjust the volumes, adjust the rate, adjust the mode. We got to figure out what's going on right here. Because I ain't finna sit here and just, nah, hey, I'm not a vent. I'm not a ventilator, you feel me? I'm a respiratory therapist that works with ventilators, but I ain't just know. So I go in there. Something happened with the patient where something was this large, the patient was turning and twist, something was this large, something going on. They say the peak pressures have been screaming ever since they moved the patient around, something yada yada. Alright, cool. What I do is, we in the mode volume control. Let's say we in volume control. I'm just giving you a scenario. You gotta use critical thinking. Let's say you in volume control. When you in volume control, you gonna get that volume every time that breath is delivered, no matter what. No matter how atelectic the lungs is, no matter if you about to bust the lungs, volume control don't care about nothing. I'm gonna do what I gotta do. So, patient on volume control. Peak pressures through the roof, 55, 59, 61. This is dangerous, dog. I gotta tap into RRT posse, critical thinking. What would the posse do, you feel me? Because multiple heads are better than one. So I tapped into y'all. Y'all was with me. I thought about y'all, you feel me? So I'm like, all right. I've been checking on this patient all night. The peak pressure's been around 40, 42, 38. Okay, cool. Let me go to pressure control. You feel me? Pressure control. And let me set the pressure to be what the peak pressures had been. 38, 40, 42. That's what I did. I set the pressures to the pressure control to 38. Then I go back on the vent, servo I. Certain buttons you can press. Bing, bing, bing. I'm going to tell you these buttons when I get to a vent and I can really show you what's going on. Certain buttons that you got to press that'll tell you what peak pressures the patient has been at, what minute volumes have the patient been doing throughout the whole time on the vent. what tidy volumes they were doing throughout the whole time on the vent. So I found out the minute ventilation was around 10 and a half. Okay, so I adjusted the pressure control to 38. I'm looking at the minute ventilation. It said 9.7, 9.6. That's good, but we've been at 10 to 10.5. And I still got room to play with the pressure control because the peak pressures had been 40 to 42 all day, you feel me? That's how they've been running because they got pneumonia, peak pressure a little elevated. Okay, cool. So I then adjusted to 40, pressure control of 40. Now, minute ventilation returns to what it's been. So does the tidal volume that the patient has been receiving. It returns to what it has been, but at a pressure control. So sometimes it gets that normal tidal volume, and sometimes it gets less. It depends on what the lungs can take at that time. We don't want to hurt nothing, you feel me? And that's key to know. If I didn't know critical thinking, I wasn't really on my toes, I'd be, I don't know, just leave it. Because they were saying, yeah, the peak pressures are alarming, but the patient's getting the same tidal volume, so just leave it alone. No, you can't do that. These peak pressures set for a reason, dog. This is like an emergency alarm. So you gotta really know what you're doing, dog. That's why, like, take your schoolwork serious, dog. Really do your job. Everything you need to know to become a therapist, they're gonna give it to you. They're gonna give you your fundamentals. It's up to you to, like, keep growing, keep being willing to learn as you go in the field, you feel me? Because I didn't really know that when I first started off. But I got with another therapist who had been a seasoned therapist. When they had an event, I shadowed them. Okay, this patient not doing good on this mode. Let me go to this mode. All else fails, we go to pressure control. That's what I did. Pressure control. Hey, man. Big Money Bound TV, I got us, dog.